There is nothing more personal than our health, unique to each of us. It guides how we live, thrive, face adversity, and the way we manage our health continues to evolve in today's increasingly dynamic world. A world that demands personalized care across a full spectrum of health and well-being. Teladoc Health is making it possible with whole-person virtual care. Combining technology and trusted expertise to connect people with the right care wherever and whenever it's needed. Empower people with insights that inspire and accelerate better health decisions. And foster clinical collaboration that leads to higher quality care. Our vision is to make virtual care the first step on any healthcare journey. Because health is personal, our commitment to improving it is personal too. We're on a mission to empower all people everywhere to live their healthiest lives by transforming the healthcare experience. Teladoc Health, better health made possible.
Welcome to the session, Virtual Care is Care. My name is André Picard, and I'm the health columnist at the Globe and Mail. And today I'll be the moderator for the chat that we're going to have. Joining me, virtually of course, are two seasoned leaders in the field of digital health. Dan Trencher is the Senior Vice President of Corporate Strategy at Teladoc Health, one of the oldest and most comprehensive virtual healthcare companies in the world. And with him today is Joby McKenzie. She's the Managing Director of Teladoc Health here in Canada. Please note a change from the program. Jason Gorovic, Teladoc CEO, was not able to join us today because he's a bit under the weather. So here's wishing him a speedy recovery. Now, COVID-19 drew unprecedented attention to virtual care. Suddenly, because of public health restrictions, we started treating patients in ways that previously we thought were impossible. The distinction between virtual care and in-person care became blurred. There's no more E in front of health, or at least we hope so. Now, most patients like this. So do a lot of practitioners and healthcare institutions and benefit plans. You know, as a health journalist, I can tell you, I just get daily complaints from patients and families, people saying, oh, why do I have to spend hours traveling for a 5-minute appointment to renew my prescription? They hate paying exorbitant parking fees at hospitals. They find access difficult, especially outside office hours. These nuisances largely disappeared during COVID, at least temporarily, and they did so because of our shift to digital. But that sudden shift happened in an extraordinary circumstance, once in a century pandemic. It was a reminder that our health system tends to be quite set in its ways, resistant to change as well. The system can be complicated and frustrating to navigate, and inefficient and underperforming from a business perspective. And now we're seeing, unfortunately, many practitioners, hospitals returning to their pre-pandemic ways, rather than embracing a more patient-friendly hybrid model. They're putting that E right in front of healthcare again, and we don't need that. So we need to ask ourselves, why is the consumer experience so jarringly different in healthcare? Why do banking and travel and many other sectors, why have they embraced the digital world, and their customers have too, but healthcare continues to lag? Now, before I lead a discussion with Dan and Joby, I just want to tell you a little bit about Teladoc. You saw the video, gave you a good introduction. And of course, in this audience, they're well known. But this is a company that started operations about 20 years ago. It's now global, more than 5,000 employees in 175 countries, and of course, including Canada. So let's get right to the discussion. We have a lot to talk about. So Dan, I want to welcome you to eHealth 22. When I was listening to that video at the outset of the session, I was struck by a couple of things. I heard about the company's vision, a vision to see digital healthcare become the front door to whole person care. So I'd like you, those are really intriguing terms. I'd like you to elaborate a bit on that. What is whole person care?
Thanks, Andre. And again, thanks for welcoming me here. Jason's very sorry he couldn't join, but glad to be here in his place. So great question. And let me start there with defining sort of the category a little bit of what we mean by whole person care. So whole person care delivery model is one that's based on addressing an individual's full set of needs, both physical and mental, as well as taking into account socioeconomic factors, as we say, social determinants of health, to help one be healthy and to realize better health outcomes. And that's how we look at it. And we use virtual care to really bring that model to life. As Teladoc, we deliver and enable millions of virtual care visits each year, providing access to convenient whole person care across a range of different sort of clinical areas. And that's what this slide highlights, crossing primary care, specialty care, mental health care, chronic and complex care, and more. And also including providing the platforms that all this care is coordinated around, and a lot more about that as we go through our discussion here. So addressing, a patient's full set of medical and physical care needs and helping address some of those social determinants as well. You can think about avoiding transportation needs by virtual care being available, right? And helping consumers who maybe can't do appointments in the middle of the day, but can access care at different times of the day or different times of the week. And also one of the themes today, I think, is going to be whole person virtual care is a lot more than just a live video visit between a doctor and a patient. That's where it started. But now it includes provider-to-provider interactions, digital self-management for patients, monitoring and coaching and behavioral nudges to help with behavior change and improving chronic conditions. And that's how we're transforming healthcare. We're normalizing and redefining what virtual care means, and in particular, enabling hospitals and health systems and providers in general to deliver virtual care for their patient populations. We saw during COVID, as you mentioned, André, the promise of virtual care and how it changed how hospitals and health systems deliver care. A huge peak back in March and April and May of 2020. And now it's stabilized at a level below the peak, but certainly way above where things were beforehand. And so COVID did become an accelerator for hospitals and health systems to adopt virtual care. I know that we're probably best known for a talk to a doctor now type service as Teladoc, but we do have a large and growing business that Joby will talk more about, providing virtual care platforms for hospitals and health systems, which are software and hardware and networking and overall enabling providers and systems to manage their patients, extend provider capacity and expertise over time and geography. And so I guess the answer to how we innovate is innovation is delivering that whole person unified care experience and not just solutions that address individual sort of one-off health conditions, all through an integrated front doors that really meets consumers' expectations now about how they should be able to access healthcare. So let me stop there.
Yeah, I was going to ask you to elaborate a little bit because I think as a lay person, that's what I think of virtual care is this one-off visit to a practitioner. Can you talk a little bit more about what virtual care means to hospitals and health systems, of that big picture stuff?
Yeah, absolutely. So, virtual care can add capacity to hospital systems, right? As there are physician and nursing shortages. So a use case that's gotten a lot of prominence recently is we think of it as call it virtual nursing, right? So you have a huge staffing challenge, right, in every facility in Canada and elsewhere, where you don't have enough nurses for all sorts of reasons. That supply has dropped and now the demand is higher. And so we're working on solutions that can allow nurses to cover a much greater range of rooms in a hospital by putting in essentially a virtual care endpoint in every hospital room. And we're seeing a lot of our clients who are very excited about that, right? Because that allows them to expand the capacity of what can be served through that sort of very limited nursing capacity today. We also see, experiences around bringing clinical expertise to the point of care in real time. So traditional use cases like telestroke and tele-ICU that can really allow systems to take some very precise, sort of specialty expertise and have it cover a greater part of their catchment area, right? So, or to enable them to expand their reach in partnering with other hospitals and health systems in their local area. And it can enhance how hospitals and health systems manage patients when they leave the facility, right? Chronic condition management is a huge challenge, and chronic conditions are a huge challenge. And so utilizing virtual care platforms that have integrated devices and AI behind the scenes to help provide those nudges to a consumer to help change their behavior and improve their outcomes. That's hugely beneficial, right, to a hospital or health system, and brings in more data that they can use in managing that patient care over time.
Great. And we'll come back to some of those big challenges like health human resources later, because that really preoccupies the system right now. Joby, I want to bring you into the conversation if I could. Again, welcome to eHealth 22. We think of the Canadian system, as it's a public system. We think of it often as a government bureaucracy, but Teladocs have been operating in this country for a couple of decades. Like, we have many private providers. Can you help us understand how did digital health providers fit into this puzzle called Medicare?
Yeah, thank you. Hello, everybody. It is true that traditionally we think about digital health as those providing healthcare benefits to private insurance plans, which we certainly have done for decades, in fact, providing the services that Dan just introduced to you across physical, chronic, complex, et cetera. So I'll say that is certainly where we have helped millions of Canadians over the years. And what we're here to talk to you about, I know that is the captive audience that we have in front of us, is the work that we're doing to bring the technology, the devices, and the enablement tools that Dan just shared with us into the hospital and health systems across Canada, again, with the purpose and mission to help more Canadians live their healthiest lives. And so, two worlds, I'll say, that complement each other, and different yet overlapping capabilities for both types of plans. Of course, in Canada, as you point out, André, most Canadians, as a proud Canadian, I will say, important to us to preserve and bolster our public healthcare system. And so we know that's obviously a focus for us given our capabilities.
But we can have a public healthcare system and still have good digital health. It doesn't have to just be in the private realm.
That's exactly our hope.
Now, I want to talk to you. You're wearing your corporate hat right now, but you also have a personal experience with the health system and some frustrations. Your son Calvin was treated for cancer. Can you tell us a little bit about how an integrated, interconnected system could have changed your family's experience?
Yeah, I will certainly share that story. And I'll say that, this is my story, but I know that in the audience, everyone has their own unique story, which is why, as we think about whole person care, it helps to meet people where they are on their journey. And so, just to share a bit of that story and why I have such passion to bring a better healthcare experience to Canadians is, yes, indeed, my son Calvin was diagnosed with leukemia in 2017. He was 5 years old at the time, and he presented with an aggressive form of leukemia. So he had chemotherapy every day for 3.5 years. He spent about 20% of his life in the hospital, and he also missed half of his school from kindergarten to grade 3. So let me just talk to you a bit about, some of the things that we observe, my husband and I, over those 3.5 years. And I'll say first and foremost that he is 2 years post his treatment and a thriving 10-year-old. And that highlights why all of us are really proud of our system, because we have amazing physicians and hospitals. And so my points are more about, and what else? What else can we do to make it better for providers, for patients, for families, for moms, and siblings? So first observation is that every appointment Calvin had over those years happened in person. That meant he missed school and we missed work. The second point is, because he had leukemia, every time he had a fever, we had to go into the emergency department in order for him to get assessed. He had a VIP pass at the hospital. It's a pass I think that nobody wants, but even with that pass, we observed nurses and doctors working so hard running down hallways, chasing alarms, the next emergency patient that came in. And with that pass, it still took us 5 hours to get assessed and to be able to be discharged, just recognizing how hard the folks were working and how potentially there would have been other ways in order to work with those clinicians in a different kind of way in our visit. Third is I carried around a 3-inch binder for years that had his labs, prescriptions, consultation notes. And so I always think about data and how important that is to help people live healthy. Point 4, and I'm wrapping up at point 5 if you're wondering, his GP called me often to check in, so his pediatrician, to see how he was doing. And interesting that the data didn't flow from the hospital to the pediatrician. And then I guess my last point is I've talked a lot about physical health here, and that was certainly the outcome to get him to health. But certainly through that journey, both him and his 2 siblings and my husband and I did require mental health support. It is not just about physical health, it's also about mental health. And so did make me see opportunities of how we can improve.
Great. And I'm really glad to hear Calvin's doing better and thriving. The story of the binder hits home with me. I had 2 older parents who went through the system. We had big, thick binders of their documents. And I always noticed that nobody ever read those binders. We just did tests over and over again. So I really yearned for digital health then. So Dan, I wondered if I could bring you in on this as well. What I'm hearing from Joby's story is something I hear from patients all the time. We want the right care at the right place at the right time. So people often, they're frightened of digital healthcare. They think it's going to replace it. We're not going to get to see our doctor anymore. Can you talk about getting that mix right and how important that is?
Yeah, no, thank you. And thank you for the story, Joby. I'd say the biggest theme here is about, it isn't in place of, but it's bringing care to where the patient is, right? And that can mean physically, and that can mean sort of emotionally. It sort of comes in some different forms. So one of them is, and one of the big themes is bringing care into the home. Right, and we call that care at home as an example internally. But imagine if more of those specialist visits, right, could have occurred with the beaming in the specialist to observe and talk with Joby and her family, or the mental health access into the home, or monitoring or post when there's a post discharge situation, not having to go in to get checked. Those can be very powerful ways to bring care physically into where the patient would rather be. There's also the type of technology, right, the patient is using. So we're really careful not to introduce new disparities in care by requiring everybody to have a high fidelity Wi-Fi connection to utilize virtual care. So everything from a range of phone calls to video to mobile apps, to if patients are now or consumers are now using new devices. We have a partnership as an example with Amazon Alexa, so you can access care that way. And so we try to be agnostic, but bring care to wherever that consumer is, because that can be really powerful for getting more efficient care, but also care that is easier to access for consumers, particularly when they're most in their moment of need.
And can you elaborate on one point you mentioned in passing? I think it's one get discussed a lot in Canada because we have a public system, is how do we make sure we don't make the care gaps worse, that this isn't just for the privileged, that everybody has access to digital care?
Yeah, that's a great point. And we talk about democratizing care, that virtual care should actually make it easier, right? It certainly shouldn't introduce new barriers. And so I mentioned a little bit about the technology itself that's used. But if you think about, a key barrier to accessing care for a great part of the population is time, transportation, expense, and those are all barriers that can be effectively overcome with a sensitive use of technology, and being able to bring the expertise that patient needs, that is coming from their doctor, their care team, et cetera, and bringing it in a way that's much more accessible into their, their own schedule, their own environment. So I see it should absolutely be a democratizing force for bringing healthcare.
And Joby, I want to bring you back in. Dan talked earlier about, how digital health can help deal with some of the big challenges. Probably the biggest challenge in healthcare today in Canada and elsewhere is health human resources. Can you talk a bit about how these platforms can help solve some of these problems, maybe fill in some gaps where we're really desperately short of workers in person?
Yeah, so I certainly see it in terms of family and friends that are in the system needing care. We see it from a numbers perspective around access. We read it in the newspapers in terms of shortages. I should also say that I'm a board director on a hospital, so I certainly see the data, and it is a concern. It's a concern in a way that I know the system is working very strategically to say, how do we work upstream? How do we provide tools? And just on the topic of tools, is everybody wants to come to work feeling engaged and working at the top of their scope of practice. Back to my story around observing how people are spending their time. One of the examples that Dan touched on lightly is just how do individuals spend their time when they're on their shifts? So how can we prevent nurses from, having to go from the nursing station when the alarms are going off into the rooms, gowning up if the patient's in isolation? All of that takes several minutes, only to hear, in fact, that the patient needs a drink of water, for example. So how can we use the TVs to have a quick chat from the nursing station about what the need is, or bring in the medicine at the same time that you're coming in because their pain is higher, that you need to talk to the doctor. So those types of tools are certainly important. But the other thing that's important, certainly in this vast country that we have, is how to use technology to bridge where specialists and physicians are versus where patients are. And so that is another unifying way of how do you actually bring these services to everybody, not just people who happen to live in downtown Vancouver or downtown Toronto. And so really important from a capacity perspective, because you just can't replicate all of those systems around the country, but everybody deserves access to the specialists. So for example, how do you use a virtual platform to bring that specialist into Sault Ste. Marie, and that you have a device, we call them our robots, up in Sault Ste. Marie, so the doctor can be able to use the same assessments that they would for an individual who might be sitting in Toronto Western Hospital. So again, technology bridging, but also adding capacity.
Right. Yeah, one of the most powerful parts of digital health I've seen is actually a family doc and a specialist in the same virtual room, which never happens in real life. So that can be really important for patients and families. Dan, another big challenge I've found it, especially in the Canadian health system, but it's not unique, it exists in the US too, is the lack of interoperability, the systems that don't talk to each other. In Canada, we have a hospital row in downtown Toronto. Some of those hospitals are side by side physically and can't talk to each other virtually. How can these systems help that with that translation, getting these systems talking to each other?
Yeah, it is a critical point, because a key factor in health outcomes is, of course, continuity of care, and whether it's transitions in care from from a facility to the home or to other type of care setting. That sharing of data is really critical. And I think it starts with how are the systems built, and so we certainly, our approach is to build with openness and open architecture in mind, most commonly with APIs, but there's certainly other sort of technical solutions there. But that's how we built our Solo platform, so that data is interoperable and shareable with common legacy systems, such as electronic health record, of course, or imaging systems or lab ordering systems, but also forward compatible, so to speak, with new solutions, let's go, such as new devices that might be put into place to allow for home monitoring, as an example. And so it is hard to retrofit, and it's why it's important as we're rolling out new systems that they are built with openness in mind. And it's also important for how we deploy systems, meaning, as our clients tend to deploy our solo platform, there's a key step, which is integrating with all those systems that I discussed. And obviously, it's a handshake, between our platform and those other platforms, but it's something we have a lot of experience with. And as I said, because we sort of built it that way, it's a lot easier to do than if we were trying to sort of start after the fact.
And while you mentioned the word integration, while we're on that theme, the other big one, I think another big challenge is, you mentioned it earlier, chronic care. 2/3 of all our health dollars go to treating chronic illnesses. People really have trouble navigating the system if they have 3 specialists, et cetera. This seems to me a real opportunity for these platforms to really make a difference there, for patients' lives being better, getting appointments online rather than going to 3 institutions. Can you talk about that chronic care component and how important it is?
Yeah, absolutely. And that's something that's truly central to how we look at whole person, our whole person care strategy. And we all know the stats at a high level, right? That, the majority, 75% plus even potentially of seniors in Canada and in other developed nations have multiple chronic conditions often. And that's what's often not appreciated as much or overlooked, is that it isn't just the individual diabetes condition or hypertension condition. It is the confluence of them together, which both increases the complexity of the medicine and the disease, but also the solutions, right? That need to be applied. Right. So what we see in our data is that it's very common for diabetes and hypertension and mental health, really importantly, often travels, with those other conditions, and it is logical why, right? And in terms of, how one can feed into the other. And so our approach and how we help our clients is to be able to bring that sort of whole person approach to bear to help address each of those different conditions, because we've seen in the data that costs and outcomes improve dramatically as you address the first condition, then the second condition, then the third condition. It really is multiplicative if you can really address all of them. And we have, when we work with our clients, we recognize that in some of those cases, they're certainly, well-staffed, so to speak, relatively speaking, to manage, diabetes, manage heart conditions, but maybe they're short-staffed on mental health. Everybody is, right? From the ground up. And so that's part of the sort of the flexible way we try to work with provider entities. Is maybe, if there are areas where we can help in terms of wrapping around sort of coverage in particular specialties or particular times a day, that's also possible. And so it can really help in bringing that more sort of whole person approach that can address those comorbid chronic conditions. Because that's what's driving cost ultimately, as well as, overall health outcomes.
And Joby, if I could bring you back into this, I just mentioned some of the big challenges, health human resources, interoperability, chronic illnesses, people mentioned in the chat, data is important, bureaucracy, there's a lot of challenges. Can you help us understand how you bring this all together? I think you have a good slide I saw on this earlier that you could share with us on this.
Absolutely. I'm loving watching the chat. I also picking out the word fax. Yes, we also love fax machines in our great country. So yes, it takes magic. I joke, but certainly it takes a purpose with underpinning solutions to bring this all together. So how do we wrap around the whole person in a way that some of you can imagine how you would use it? How do we, from an individual perspective, make it personalized? So let's just start on the left-hand side of this slide. Care happens everywhere. Appropriately, someone in the chat asked a question about sometimes you have to go in person. 100%, just based on my story, that my son had a lot of blood work and had to access his port and all sorts of procedures. Yes, care must happen in person, and care can also happen outside in someone's home or place of convenience. So care does happen in multiple places. And every individual's journey is different. So in the middle here is Judy, and just as we've been talking about chronic conditions, she has high blood pressure. She's looking to, increase her energy in some way, given her conditions. She needs access to a doctor or is getting surgery and really is wanting to ask somebody about that. Or acute episodes where all of a sudden she has a fever and doesn't know, in fact, if she should go into the healthcare system. So everyone's journey is different. And I'll say where care happens is different, but the only way I think the solution of improvement is to make it simple. How do you understand where you should go? And simple isn't normally a word that's synonymous with healthcare, but how can you make it simple to know where to turn when? How can you use people's time appropriately, both providers and individuals receiving the care? How do you know, how does that information, how does the data flow in a way that follows the individual and not completely redoing assessments over and over again? There should almost be an equal sign in the Canadian context around affordability, because more doesn't have to be more in dollars. Very alive to the quadruple aim about improving the experience for patients and providers, health system level, as well as affordability. So we are all taxpayers in this audience, and that is important. The important thing around data is that it flows around the individual. The platforms can connect from primary care into acute care. It is integrated into EMRs so that we're not asking providers to take another step when we know that they already don't have moments in the day. So as we think about ourselves, sometimes we call ourselves tool makers. But also we know that healthcare isn't just the 3 visits you have with your doctor every year. Healthcare is every moment of your life, about decisions that you're making on what you're eating and what activities you're engaging in. And so that's a bit of what Dan talked about in terms of supports. We have a stepped care approach, which is self-care, our diabetes program supported by coaches, but mostly self-care of programs that people can use that has an underpinning ROI, moving up in the acuity so that you use clinicians for the higher acuity points, but also the data that flows between so that people can manage their own care. I think nobody cares more about your health than you. It's really about putting the tools in the right hands of individuals.
Great. Now I've got some good audience questions coming in. I have a couple other quickies I want to get in from my end, and I want to then get to audience questions. But I want to get back to Dan. A lot of companies in this field, in tech, in digital health, make a lot of big promises. This audience wants to know, how do you measure results? How do you make sure you're getting a return on investment for this?
Yeah, absolutely. And that is not a new question, absolutely. And it's one we're really happy it is asked. And I actually think what's interesting here is that virtual care actually provides the opportunity to have even greater application of evidence-based medicine, right? The opportunity is there. And so just a couple of examples. So if you're talking about, somebody's mental health sort of access and therefore utilizing a therapist or a psychiatrist, if you apply sort of a true mental health sort of system and platform, and have an upfront screener, right? And then you're able to measure over the course of time, how is that patient doing in a consistent way? And it's really built right into the platform. And that data is shared with the provider or other, relevant sort of or researchers. You can see how that sort of trove of data is actually more than you might normally get in a community setting. Another example is, as we've talked about, diabetes programs, right? And so there's self-management, there's coaching, there are the behavioral nudges I talked about, but there's also a device that's connected actually via cellular, so nobody has to worry about like connecting Wi-Fi or Bluetooth or whatever. And we capture those data points, right? And that's pulled into our system and used for AI algorithms, and sort of that's what drives some of the messaging to a consumer. But it also is measured so we can see how are they doing, right? And it's not a journal that the consumer has to remember to jot down and bring into their doctor's office every 6 months or a year. but it's in there already. So their doctor can see exactly how they're doing and how, different times of the day or with different meals as they're answering questions, through the platform. That can really drive an evidence base that is superior to what you normally would be able to get, right? And so we welcome always talking about, showing value, because we can see through the system, how people are doing and how they're progressing over time. And so it absolutely should be part of, every program and program's evaluation.
And value means something different to patients. So we have a good audience question. I'll just sneak it in here because it flows from it. They're asking, how does Teladoc empower the patient? How does your platform, what does it do for me, essentially?
Yeah, and Joby, please jump in as well. But that is actually a really key part of how we talk about it. We talk about sort of three verbs. We talk about delivering care, we talk about enabling care, and we talk about empowering consumers. And some of that is providing them with the tools and sort of the insights to make the best decisions for themselves over the course of their lives. As Joby said, very little healthcare of the time on healthcare is actually in the office, in the physician's office. Most healthcare is on the go, the choices you make in terms of how you're eating, and other sorts of elements of your lifestyle. And so a lot of the empowerment comes from providing the consumer actually with consumer-friendly tools and data and information and feedback, so they can see how when they make a decision about what to eat, or how they're sleeping, how it impacts their blood pressure, right? How it impacts their blood sugar, how it impacts their weight, and how it impacts their mood, right? And so it really is empowering to the consumer to have all that data, at their fingertips, with the right sort of supportive guidance that we provide, so that they can know and make the right decision for them, the next time around.
Joby, you talked about this earlier about your son. Anything you want to add about that empowerment part of the puzzle?
I think as Teladoc, we're excited about the solutions we have. Of course, we've been investing in these programs for a lot of years. I think what's important for any individual is if you are a separate health service from your diabetes versus your fever versus your ongoing, checkup, it's 100% likely that you're going to be confused and not get the impact that you need. And so a lot of what we've been doing, obviously, is to build out programs that aren't just point solutions, but really wrap them together. But I'll say the most important thing also in the Canadian context, we take our global solutions and then localize them into Canada. And the way that we know we have to do that is through partners. So to empower patients means that we need to work with the system to provide those flows of information and technologies, give them their data when they need it and programs when they need it, but have that flow into the system, have that empower the clinicians so that they can also do their job. So very alive to the fact that, yes, patient is one part of the equation, and the system and us partnering effectively is another important part.
And Joby, while I have you, I want to ask you a question. Maybe it's a naive one, but like many people, I've spent most of my life the last 2 years on Zoom. Why can't we do all this stuff on Zoom? Why does it have to be something new and special?
Well, I mean, certainly some stuff can happen on Zoom, as we know today. But the approach that we take, we have this platform called Solo. So just a quick picture here. It is a clinical platform now in partnership with Microsoft. Again, remember my comment that we know, we must not reinvent the wheel. We must partner in order to be effective. So Solo in partnership with Microsoft, which just means that there's a virtual platform that can plug into EMRs that in BC, hundreds of clinicians are using it. We've had thousands of appointments using Solo. Across the use cases that you see across the arc, whether or not it's low acuity or high acuity. Dan's mentioned telestroke, neonatology. How do you bridge downtown Vancouver up to Prince George? So it is different because there's virtual waiting rooms, and it's clinical in that two doctors can join at the same time. You can bring in your circle of care. You can upload your images. Zoom wasn't built for healthcare. Our platform's built for healthcare, for patients and for providers in mind.
And Dan, while we're talking about partnerships, we heard about Microsoft. Somebody's asking, can you tell us about your partnership with Amazon Alexa?
Yeah, absolutely. Something we're certainly excited about. And I'd be the first to say we're scratching the surface on what we can do with voice. And you know, obviously Alexa is sort of a voice and actually video partner as well. So where we started was simply enabling access to Teladoc sort of care services, you know, physicians, physician visits or other types of virtual care through an Alexa device, right, as sort of a point of access. And again, either sort of the audio version or actually that Amazon also has video versions as well, which we'll integrate with. But I say we're scratching the surface because you can think of many applications that are really uniquely powerful through voice. Such as in a post-discharge situation or a hospital at home situation where, you know, that individual patient could really benefit from not having to worry about a phone or any other sort of, you know, sort of endpoint, and really just talk to the speaker and interact with their care team or access a provider or ask a question or what other various use cases. And so we're pretty excited about what that, you know, voice in this case, primarily as a tool, can add to our sort of approach of, you know, being where the patient is and expanding access.
And sort of a related question about apps. Can you tell us where apps or point solutions fit into this? I read recently there's something like 400,000 medical apps available. How do these fit into that environment?
Yeah, it is one of the biggest problems from success in virtual care is that there are hundreds of thousands of medical apps out in the various app stores. And what we hear every day from you know, clients as well as from consumers is that they went from, you know, excited and looking at innovative you know, new options out there to immediately now overwhelmed. They're overwhelmed by, you know, point solutions. There are solutions for subcategories of mental health, let alone all the different sort of specialties. Like as a consumer, you don't want to deal with a sleep app and a you know, a stress app and a anxiety app and a meditation app, and you know, and that's just one, you know, category. And so what we're seeing is you know, that purchasers like a hospital or health system are looking for more broader solutions to help remove some of the need to manage tons of different point solutions, and also for greater integration between the solutions, particularly on the front end, both the physician experience and the patient experience, so that those users aren't exposed to perhaps the variety of different solutions behind the scenes. And that's why, as Joby is saying, a platform is really important. So you could have one app, you know, one site, you know, one screen where that physician or consumer, you know, can access everything they need to see in an integrated way, and not have to worry about downloading 20 different apps and sort of managing different profiles and such.
Well, Alexa is telling me I only have 2 minutes left, so I want to squeeze in one last question for both of you. And it's a kind of an angsty Canadian question. Teladoc is a US-based company. There's very marked cultural differences between our countries, especially in healthcare. So I'm interested from each of you, how do you bridge these gaps? Joby, how do we do this in Canada and not fall into the trope of we're going to be an American system?
Yeah. Yes, a proud Canadian, as I said. So you're exactly right. Maybe I'll just pull out a few of the challenges, because I feel as a health system, we are standing on a burning platform, whether or not it's the health human resource challenge or the fact that people's health has been compromised, mental health, people's self-report has gone down, chronic conditions have gone up, but delay in diagnosis. And from an economic perspective, a taxpayer perspective, we spent more on healthcare than we can afford. So we are standing on a burning platform. And I have also had the privilege of working for Canada-only companies. And what's interesting in that context is you only have Canada to build your business case to build solutions, which means you don't have the benefit of the global market to say, I can spend millions of dollars on R&D for innovation and bring it to Canadians. And what we have as Teladoc, which I think is really important for Canadians and those of you in the audience, is that I feel like a kid in the candy store. I get to go shopping at Teladoc globally to say this use case has worked in Spain and this one in Missouri, and how can I take these technologies or programs and then localize them? How do I work with health system leaders in Canada? How do I work with the Epics and Cerners that are installed in hospitals so that I can take the tools that have been built for a global market and invested hundreds of millions of dollars in, and have Canadians benefit? For me, that solves the challenges that I've talked about. It brings in the platforms and the devices and the programs that allow Canadians to benefit, but that it is a Canadian solution for Canadians.
Great. Well, that's a good term to end on, Canadian solutions for Canadian problems. Unfortunately, it's all the time we have. Hopefully, the audience, you've all found this discussion, virtual care is care, exciting and interesting, and that we'll all get excited about the future of whole person care. I'd like to thank Dan Trencher, Joby McKenzie of Teladoc Health for a really enlightening and fun discussion. And of course, thank you all in the audience for attending and being active participants. Please don't forget to visit the networking lounge where we can continue these conversations. Join the all-important patient partner meetup sessions that are coming up this afternoon. And please stay safe. And thank you again for being there. Remember, we don't need the E in front of health anymore.